tragedy still unfolding for the students in terms of when they have to go back to school and the mental health counseling that needs to be available to them and for the law enforcement officers.
Yeah. That'd be horrible. I mean, they'd have to go in and see what happened. So, CFO?
Thank you, Governor, and thank you for what your leadership through all this. I know that you go to all the funerals and you visit with all the families. And the one element that I want to make sure that we bring to light, and I appreciate our first responder community we've gotten here, but is echoing what's been said is making sure that the first responder community has access to the mental health treatment that they need, and that this is not something that we don't put in whatever legislative proposal that we're going to have in debate. We've been advocating for it for months, and it's unfortunate that we have this as part of the dialogue today, but it's real, and those heroes will have to sort through this, because right now there's not a professional outlet that they've got to get the treatment and help they need post an event of this horrific nature.
Sure. Sheriff Atkinson, do you want to start by talking a little bit about the things that you all had a list, and you want to talk about the things you...
I think this morning when we met, there was really a broad consensus on a variety of topics, and I think that in and of itself is pretty strong. Governor, you touched on one of the things, which is, or Attorney General, you touched on one of these, which is some changes we need to see made to the Baker Act. Certainly a broadening that would allow us to be able to do what I think the public believes we already do, which is to protect those individuals and the public from people who do not need to be in the profession of firearms should have their time. And I was glad to see that uniformity and consensus in that. Our number one request or our number one idea today really revolved around the school resource deputies, school resource officers. We believe they're vitally important in maintaining a relationship both through the schools but also the safety of the children. And that's the bottom line. We've also said that if that is not attainable, we ask that a consideration be given to a form of a second-tier program, something similar to the Sentinel program that Sheriff Judd has discussed in Polk County, whereby we use the special deputies with an advanced level of training to help protect, quite frankly, as a last line of defense for these children and the teachers, and so that they may defend themselves. We understand that each county in the state of Florida is different, and that requires probably an opt-out or some consideration in that.
Sheriff, can you, one thing we talked a little bit about, and is this, here's the way I've looked at it. I've looked at things as a businessman. We always had goals at the end. What are we going to get out of this, right? The easiest thing is to come here and say, oh, let's spend some money, but what do we get out of it? So let's take the school resource officers. Do you have an idea of, what the standards should be, and then also how do we, I think the expectation is all of our schools have an active shooter plan. How do you deal with, and we talked about it a little bit in our meeting, how do you deal with making sure there's some accountability, that somebody signs off, that somebody's accountable? Because I think you're accountable, the chiefs are accountable. If I was a superintendent, I'd feel like I was accountable. So how do you do all that?
You touched on that at our meeting, and I've always been a believer in Dr. Deming's principles, which is if I can't hold someone accountable, then I'm really going to tell you they're not responsible. And so somebody needs to sign off and own that plan. It's a partnership between multiple entities in the county, but at the end of the day, somebody has to be responsible. Somebody has to make decisions. I think that is absolutely crucial. I would also touch on the point you just made about what is the proper ratio. I think there are standards out there that we can get to a point that, quite honestly, one SRD can't handle 3,200 students. One SRD can't handle a multi-acre campus. There has to be a really pragmatic approach to doing this that takes into what are acceptable standards, and there are good standards out there for us to review. I think that's something we certainly believe in partnership with hardening the facilities where we can. But as you said, Governor, there should be benchmark deliverables about what can be accomplished and achieved here. People need to know what is being done, and they need to be able to have tangible result to that.
Superintendent.
In reference to the active drills, we've done those in our county, and I know today we talked about including kids and students, But it also talked about all the different scenarios, because it's one thing to have all the students in the classroom, but then now you've got students in the cafeteria, some on the football field, so there's so many scenarios with that. But to be held accountable, we are held accountable for all of our drills, because we have to report. It's based on a certain amount of fire drills, hurricane drills, and we have departments that monitor that, keep a list, and I'll tell you, she's a bird dog. She calls the schools because they have to do everything so many times
That's
a
at the
month.
district level?
Yes.
Okay.
So, and we've been to the end of the school year when some of them didn't get them done, so we have to hold them accountable.
Sure.
One of the things, Governor, that an absolute measurable, right now there are gaps in coverage. During the day, you have school resource officers that are called to court, called off campus, a whole variety. It shouldn't be that way. Reality of current staffing levels.
Because they have more than one job. Is what you're
Well,
saying.
not necessarily, but they may be dedicated to that school, but they may get called to court, they may get called to a deposition, get called to training, so there's 2 hours when they're not there. That leaves the school very vulnerable, and that's an absolute measurable, and my view is that there should be no gaps in coverage. The school should be covered 100% of the time while that school is in session, and that is something that could be easily implemented, but it requires funding, and it requires the resources. Resources mean funding, but that's an absolute measurable, because anytime those campuses do not have an armed law enforcement officer there, that campus is at its most vulnerable moment. And there are hours during the day where that happens.
So right now, the funding that goes through the state budget to the school system, all the safe school funding goes directly to the school system, and then they contract with law enforcement.
Correct.
Every school district does that differently.
Okay.
So some is a sharing of that, some it is totally by the school district, and some actually I think there's one district that may, law enforcement may bear that cost.
Okay. Superintendent, do you think the way it's funded now is the right way of doing it?
We contract with our sheriff's office, but the number of SROs is strictly left up to the school district based on their funding, and some I know in the past have cut back on SROs because of the safe school funding that was cut.
So, Superintendent, would it bother you if there was so we have, let's say we follow what Sheriff Atkinson was saying, that we have a standard, okay, and it's not going to be easy because a metropolitan area is going to be different than a small county, right? It's totally different, but you'd have to come up with that. But does it bother you if there was an obligation by law that you had to have whatever plan you have signed off by somebody in law enforcement?
No, that wouldn't bother us, and it wouldn't bother us if you took all the SRO money and gave it to the sheriff's office and told them that here's your funding, you're accountable for it, because we usually have a great relationship with them, and we would not. I don't think any superintendent would be upset with that.
Now, I know in Hillsborough County, Governor, because it's so large, the PD handles some schools and SO others, and they work well together. I'm not sure if every county's in that posture. And I can tell you there has not been, I've been going around talking to SROs at school, there's not been one SRO who hasn't said, I need backup. I need backup. Just like a partner on the street, chief, sheriff, right? You have backup. And that's not happening at these schools. And you and I saw how enormous that school was.
So, amazing.
Governor, I serve as a reserve officer with the City Miami Police Department, and I spoke to Chief Colina today, and he's implementing a program where he's going to use the reserve officers, who are some retired officers and some people from the community who want to serve as police officers, and he's going to redirect their efforts, and he's going to start assigning them to the schools. So there's another.
This is the city.
City Miami Police
Miami.
Department, Chief Colina.
Okay.
And this is another body of people that we can rely on, because there are a lot of retired officers out there who would like to come back and serve in a reserve capacity, which is usually an unpaid capacity. They just want to volunteer. So I think that's something else that perhaps we should be able to look to.
Now I'll speak on the SRO program, because I know every school district does it differently, but if we were to do that and whoever they found out for backup or those types of things, our SRO officers are trained with students, and it's different than an SRO officer being with the students all day than just sending in, and we've done it in our county, and I've heard it from our principals and a backup deputy, because they've just got a different mindset. And that's not a criticism, it's just they're trained differently.
Right.
So backup is good because we've had those issues of total meetings and things.
Well, the problem is, the reason why you have gaps in coverage is because it is done differently across the state. In our county, the school board pays 50% of the cost of the officer. And what is common, and I believe in Polk County, the school board, I think Sheriff Judge can speak to that, picks up all of it, but it is different around the state. But what happens is that the superintendent tells me, okay, I'm going to give you a pot of money. That's the pot of money that I'm giving you because it comes from Safe Streets funding. And you decide what you're going to staff at the schools, but this is all I'm giving you. And then we've got to fund the other half of it. And there's not the adequate relief factor. And I think that's what you're talking about. And filling in here or there with a reserve, but you have to have consistency. You need consistency of the personnel. And most would use a relief factor. Well, we don't have a relief factor. See, what you should have is a core set of SROs that are assigned to specific schools and specific posts, and then relief SROs that are SROs that are with part of the program. And that's the ideal way it should be staffed. So you have people with knowledge, people are part of the program, they're buying into the philosophy, et cetera. But we don't have any relief factor. So that's why when they go off campus, it's a hodgepodge, and maybe it gets covered, maybe it doesn't.
Governor, one of the, I think, other important recommendations or discussion we had today is that very analogy that by looking at each individual county, there should be that assessment or that deliverable of this is what fits best in Lafayette County. This is what fits best in Hillsborough County. But with these professional benchmark standards that we're all held accountable.
I think somebody's got to be, the buck's got to, somebody has to be able, I think, I think, Sheriff Judge, you said it. In your county, people believe you're the one that's responsible for keeping every kid safe.
That's correct, Governor. We have a unique relationship with our school board, which is absolutely wonderful. They contract with me for the director of Safe Schools. So we're involved in all of the mechanisms for keeping the school safe. Our last superintendent said, look, I'm a professional school administrator. I'm a professional school teacher. I want you to take over security and tell us what you need. And the uniqueness of this is we also work well with the police department. So while I'm overseeing safe schools, a lot of the schools are staffed by city police SROs, but ultimately, as the interaction comes to the school board, I'm in charge of that. We're elected by the people. The sheriffs of Florida are elected by the people. We need to work, all of us, in concert, which we do in Polk County with our chiefs, but where the rubber meets the road is I'm responsible for what happens. You give us the staffing, you give us the resources, we will make sure the job is professionally done in concert with our colleagues at the police department. I take that a step further. Number one is SROs. I have a Sentinel program in Polk County, and the reason I have a Sentinel program is, and let me give you this illustration. My grandchild at home is protected by a family with a gun. My grandchild comes to my house, they're protected by a family with a gun. My children, or my grandchildren, go to church. I've trained probably 1,000 people this last year so that they can set up security programs. When all else fails, we can stop the active shooter at the church door. I've done the same for small businesses. The school are the only place where we gather children in a large group with no protection if there's not a school resource deputy there. The only place. So if the active shooter wants to go to a place where there's absolutely not going to be a gun because everybody's rule followers except the criminal, they go to and can shoot up a school. So our Sentinel program simply does this. We selected, based upon those that volunteered, school staff. They went through a detailed background, a detailed psychological, and then we gave them more hours of training than our police officers are required to have according to the state of Florida standards. We required them to qualify at a higher level of qualifications than even the police officers in the state of Florida. We're suggesting that our Sentinel program is not the hardening of the target, which needs to be there. It's certainly not the intervention that needs to be there, the Baker Acts, the training, the school training, but it is the last best effort to work in concert with, if there's not sufficient resource officers, to make sure that when that active shooter shows up, we're there immediately. We study every one of these active shooter events. They're over in 2 to 5 minutes on average. It's reported to me that Broward was 3 minutes. The police response is +5. 911 doesn't work. It doesn't work. So we have an option here. We don't want to do this, but we have to do this because we've got to stop that person that either falls through the system or meanders around the system. And quite frankly, it will be successful, and it has been successful in the sense of the responsibility at Southeastern University in my county. And we also have some private schools now that have shown an interest, and we were already in the process of doing this with another university. But my point is, this is just one option. School resource deputies are a must, but 1 or 2 on a campus that's 45 acres and 3,000 kids, they could be tied up with some issues and never even know something happens at the other end of the campus. There has to be multiple people ready to stand in the gap and protect our children.
Do the chiefs, can we ask the chiefs, what do you think about who's accountable ultimately, and where the dollars should flow? I mean, what's your relationship? And I guess you're all in counties that you work, the sheriff and you do all the SRO, right?
Yeah, yes, Governor.
You're not, right?
I'm not going to.
Yeah.
I'm in North Broward. I live in Parkland. I live about 2 blocks from Stoneman Douglas. I am chief in Coconut Creek, which abuts it. My son goes to school in Westlake, right next to Stoneman Douglas. All the schools in Coconut Creek are under my purview. If we want an additional officer, we go to the school board, and we request an additional officer, and we match funds to put that officer on.
You match 50-50 with it usually?
Yes. And
So do you sign off on it then? I mean, is in Coconut Creek then you would be the person that people say you've reviewed their plan and that you'll be accountable?
I feel I am. Yes.
Yeah. Not that there's a formal way, but that's how you look at it.
Yes.
Okay. Is that how most chiefs are going to look at it?
It's hard to speak for all of our chiefs when we haven't vetted our chiefs yet. I mean, we scrambled to get up here for this meeting and to talk about it. But I will tell you that I feel responsible for my security programs at all my schools. My school resource officers are accountable for doing certain things logistically with our schools when they get in that week before school starts. And to what Sheriff Galtieri said, I think a huge issue is gaps in coverage. And even with the elementary schools, with many of the elementary schools have either a part-time SRO, certain days on, certain days off. And I will tell you that we did have some back and forth discussion about that because elementary schools have kind of been sectioned out of that group. I think personally that they're just as important to have that officer on site. So.
I think we all believe that. I've got grandkids now, sorry. So we all have somebody, right?
Yes. And you have 3 anomalies in Florida that are Miami-Dade, Palm Beach, and Pinellas, where the school board actually has its own police department with its own police chief and its own police officers. So the accountability there is with the police chief and the school district. So that's a different situation, but I can tell you how they run it in Pinellas with the elementary schools. There is not an assigned SRO. They use a roving SRO system, so they're traveling back and forth. So there is that huge gap. But I know we mentioned in our meeting, but for everybody's benefit, it's something that has to be kept in mind in these 3 counties where you have a chief of police who answers to the superintendent, and they have all of their own. And that's a much different model. And I think that it would be tough to put me in charge of, in that situation, when they have their own police chief who answers to and all the funding. So there are differences in a lot of what's being discussed here today and what we've discussed. Very hard to have a one-size-fits-all. We can have a certain model, we can have a certain mold, but there has to be, I believe, flexibility with some local control over some of these and recognizing the differences between the right.
And Governor, what you mentioned, and I was going to make sure you knew this, some of these schools, and correct me if I'm wrong, some of these schools have one school resource officer who bounces from school to school to school. I mean, might as well not have them. I mean, that's just not working. And if we have air marshals on airplanes, why can't we have reserve deputies, retired deputies, or chiefs, officers undercover at the schools as administrators, at least who are trained in firearms, and no one knows who they are but for the staff?
Chief, you want to?
Governor, just follow up on the SRO piece. We are fortunate in Palm Beach County. If you're looking at best practices, I think in relation to school safety, those that have the school police as their full-time job. All the work done, they're there every day.
They know the kids.
They know these kids. They become coaches. They become mentors. And, you know, a lot of the information that we get in terms of social media threats and those types of things come through the school resource officers, the school deputies that are there. And so, but, you know, the thing about having, you know, a police department like Palm Beach County School Police is it's more than just the active shooter piece. You know, it's the youth court, it's the juvenile mental health, it's all the things that they're trained to do within that school, and they don't leave that school. That's it. You know, the challenge we have, I think, sometimes in terms of funding, and this is probably something we need to talk about, is sometimes the funding is not directed towards the school police departments as much as it should be. I'll give you an example. In Palm Beach County, and they do a great job. They didn't have enough cars for all their school resource officers. I had to donate 25 of my old junk cars to them so they would have enough to give their school resource officers to respond to an active shooter. That really shouldn't happen. And so, you know, and they do it. They do the best.
We have excess cars at the state every year.
Sorry?
We have excess cars at the state every year because it hits, I think, 150,000 miles or something that we could be given.
The expectation is, Governor, that they're going to send the SROs to the school in their personal cars, and that's just not going to happen. And so I think if we want to look at best practices, we have best practices.
Bifurcated, I'm not sure, but bifurcated mission is part of the concern there. You know, from our standpoint, I think any police department, any school district, you're concerned with public safety. That is their single goal, right? We don't get into trying to make determinations about other issues, what curricula should be taught, things of that nature. It is simply the safety and well-being of children first and foremost from the public safety standpoint.
Do you want to talk about the, from a law enforcement standpoint, the Baker Act issue of how, I guess, if somebody's Baker Act, I think Sheriff Votel, you're saying it's not for actually that many hours.
Right. So when somebody, a number of issues, when somebody's taken into custody under the Baker Act, involuntary exams for mental health evaluation, and they're taken to a receiving facility or a crisis stabilization unit, is while the law allows the people to be held for up to 72 hours, I can tell you that my experience and that of every colleague I talk to, and we're very involved in this, it's usually much, much less than that. People are usually out in 6-8 hours, and because somebody's determined that, or when somebody's Baker Acted and they're brought to a CSU, a crisis stabilization unit, they're in crisis. The determination is that the crisis level is here, and then they're put out. And so the big problems for us with the Baker Act, and most people are totally unaware of this with the Baker Act, is that we take somebody into custody under the Baker Act because of a threat to others, and even a threat to others involving firearms. Law enforcement in this state today is prohibited from taking the firearms. We cannot seize the firearms. We can't take them for safekeeping. We can't take that person's gun who threatened somebody else, and that was the reason for it. And so what has resulted, quite honestly, is you have some sheriffs and some police chiefs that are holding their breath and doing it anyway because we think it's the right thing to do because we're afraid that it's going to result in somebody getting hurt. And then when the person gets out 6 hours later, is that they come across the street or they go down the street or whatever it is, they come to the police department or the sheriff's office and they say, I want my gun back. And we're forced to return it. There was a Florida District Court of Appeals decision last year because we were relying on a statute that involved breach of the peace. And the court said, no, you can't do that. You can't rely on that. You got to give it back. So we can't even seize those guns. Another big problem with the Baker Act, in my view, is, and this is a huge misperception on the part of the public, and I've heard this so many times in the media and so many times in talking to people in the last week since this tragic incident, is that people think that when somebody is taken into custody under the Baker Act, that it disqualifies them from buying a gun. That is not true. There are only two things that disqualify somebody from purchasing a gun. And this thing that we call a background check, in my view, is not a background check. It is a criminal history check to determine if somebody's been convicted of a specific disqualifying offense, or whether a judge has adjudicated somebody mentally incompetent. That's the standard. You could be Baker Acted 15 times in the last month, have 15 law enforcement contacts for domestic-related issues, tell a cop last night, I'm going to kill my wife. You get Baker Acted, you're out this morning, and this afternoon you're buying a gun at a gun store in the state of Florida. And there's nothing that we can do about it. So we believe that there also needs to close a donut hole, a loop, because we encounter people that their conduct doesn't rise to the level of being criminal, meet the elements of a criminal offense. It doesn't rise to the level of the immediacy of the threat required by the Baker Act. And so we have people who may post social media threats, may make certain statements, may do certain things, but because the immediacy is not there, we can't arrest them and we can't Baker Act them. And those people create a real issue for us. So we would like to consider three things. One is closing that so we can take action against those people. Give us the authority with appropriate and proper, because it must be there. This has to be narrowly tailored. This needs to be surgical. This doesn't need to be broad brush. We need to protect the due process rights of people. So perhaps only a situation where it's a Baker Act where there's a threat to others. The guns are taken for a cooling off period. They can go to a judge and get them back. All those details would have to be worked out. We recognize the importance of due process rights for individuals. And then at the same time, consider that if somebody is Baker Acted, that also results in a temporary cooling off period where they can't go down to the store the next day and buy a gun. So those are some real concerns that we have about what is now not available to us in the Baker Act. And again, most people think, and the public needs to know, that somebody being Baker Acted is not a disqualification to purchase a gun in the state of Florida.
Yeah. So you were a prior judge. So
yes.
Is something like this process actually, would it work?
Well, I was just going to say that. I think one mechanism that perhaps we should look at is injunctive relief. We used it back in 2000. We rewrote the money laundering statutes, and we put in, using the existing body of law with injunctions, a way to freeze bank accounts that were being used for money laundering. So perhaps this could be another way to do that. Use some kind of injunctive relief that if a situation like this arises, whoever has standing would go to court and prevent the person from getting their firearm.
So right now, if somebody, let's say there's a domestic dispute between a couple, so if somebody gets an injunction, right, is the judge makes the decision whether the guns go away or not?
Yes.
Or is it just automatic?
It's when you get charged with domestic violence, my understanding of it is you can't carry a firearm.
I think what the governor's asking is there's not a charge. Let's say there's just an act of, right now, is that a citizen on their own can walk into a clerk's office in the state of Florida, a clerk of the court's office, because of some type of domestic situation where they're in fear. And they can petition the court for a temporary domestic violence injunction. And in that process, temporary, permanent, et cetera, the judge can order the person not to possess.
But it's not automatic.
But it's not automatic. But in a situation where somebody is charged with domestic violence, charged with domestic battery, at first appearance when they're released, the judge is going to make it a condition of release. So you've got two different situations. One is that they're charged with domestic violence versus it hasn't risen to the level where there's a criminal charge, but there's enough fear where somebody has petitioned the court for an injunction. So I think what Mr. Reyes is talking about is what people refer to as a gun violence injunction, where family members are seeing certain things, there's signs, there's indicators, there's behavior, where that family member on their own could go into the clerk's office under certain circumstances similar to a domestic violence and say, I want to fill out this paperwork and I want this brought before a judge, where the judge then could say there's enough here to indicate there's a problem and this person's right to possess a firearm should be enjoined for this period of time. But Governor, that's different than what we face at 3 o'clock in the morning, because if we had to, and I think there's room for what you bring to the table for that, but at 3 o'clock in the morning, if we encounter somebody and we Baker Act them, or we're seeing certain things, and especially in that Baker Act setting, we don't have time to go to a judge because we're Baker Acting them and this person has 3 AR-15s or whatever it might be. We need the authority to be able to take them, again, with due process rights, so that they can...
So you would take it, and then they have the opportunity to go back and get it?
Correct. Yes.
Yeah. Did you add
Yes,
something?
we have my Solicitor General's office right now. Currently, I have a group of lawyers working on the constitutionality and due process of Judge what you said and Sheriff what you said regarding injunctions and Baker Act. Same thing. That you can take the firearm as long as you're not saying I'm taking it forever away from you. You would have to go before a judge to get it back and let the judge make that decision based on all the facts and circumstances. What's hurting us now is my predecessor in 2009 had issued a legal opinion saying you couldn't do that, and that was based on current state law. So that's what we're looking at, how to change our current state law, make it legal, where you do have that ability, Sheriff, in the middle of the night to take that gun and they don't get it back after they're Baker acted without going before a judge.
What about limiting the purchase the next day?
Oh, absolutely. That's all encompassing. We're just talking about taking them.
But we have to change the law.
Right.
No, I get that, but how would the gun store owner, when he's doing the background check, how would it pop up in the system that quickly? How do you?
I think you have to go back to what you're talking about. You have to change how you do the background check.
Yeah, and we talked about that today. Where there's a will, there's a way. This can be done, and there's a number of options where you could have right now, the state of Florida in 2016, which is the year that the most recent data is available for. There are about 192,000 Baker Acts in the state of Florida in 2016. About 50% of those were done by law enforcement. And if we tailor it to the situation where there's a Baker Act because of a threat of violence towards somebody else, then that's being done more surgically. It's narrowing it to that. And then if you had the receiving facility somehow that were required to report, and FDLE and Commissioner Swearingen today said that there are infrastructure within FDLE where they can support this. You could also potentially use CCIS, which is a consolidated case management system that the clerks use. There's a way to get this done so that, Lieutenant Governor, to your question, where it could be reported, the gun shops could query, and importantly, law enforcement on the street could query. So we do a traffic stop is we put it into the system and find out, okay, you were Baker acted last night, and now you've got this gun. No, you shouldn't possess the gun, and we can take action and hopefully prevent something bad from happening. So there are ways to do this, and Attorney General, one of the things that we talked about today is that if we take the gun away for a period of time, so just use hypothetically, let's say it's an automatic disqualifier for 30 days, and perhaps it's an automatic qualifier for whatever that period of time is, but if the person goes to a licensed psychologist or a psychiatrist, and that mental health professional determines the person is stable and not a threat, then they could take that to a judge, and a judge could shorten the period and give them the right to and restore that right. So
and then they have due process.
And that's the due process. So put it on them. They got to go to a psychologist or a psychiatrist. They take that to a judge. The judge can make the adequate findings because the judge needs something to act on, and then that 30, 60, 90 days or whatever it is shortened.
Mary, do you think that would work?
Yes.
Okay.
And we talked, the mental health group also talked about this very issue this morning or this afternoon, and we all agreed. The principle we were using, and it also would reduce suicide. That's the other piece, right? So it's going to be important for the suicide rate to take away the means. That's what we're doing, and always with due process in mind. But we do really have to. If we have to change state law, we need to do it. Yes.
And Sheriff, we agree when you talk about the family petitioning for the gun to be the violent offender, the gun seizure. Law enforcement could petition it.
Yeah, and that would be another way, too, is that law enforcement also should make it an option where the family, so these gun violence injunctions where a citizen could go to the courts and walk into the clerk's office and do it on their own, or in this situation, especially in these potentially donut hole situations where there's not enough to take enforcement action or a Baker Act, that law enforcement could go to the court as well if there's not some immediacy or some other way. So the gun violence injunctions, I think, have a very valuable place in making sure that the wrong people don't have weapons in their possession.
Right. Yes, sir. The state attorneys already have an obligation under the Baker Act system, and I know, General, you've dealt with this yourself, where if somebody's going to be long-term committed, we're the ones who act as the prosecutor. So we have assistant state attorneys who are specifically, if they decide we need to do a long-term, like send someone to Florida State Hospital or a 72-hour hold.
Is that in excess of 72 hours, or is it?
Or is it the first day? The 72-hour hold can be done on the deputy sheriff or immediate. Then they are going to be seen in an intake facility. So I think that the mechanism is already set there. You're having you have a deputy sheriff or other law enforcement officer who has their intervention, the behavior is such that they feel that there may be a mental health concern. You take them to a receiving facility. Now they're seeing a true treatment professional who can make that. All we would need to do in our office as the state attorney is acting. You have different levels in the mental health. You have the least restrictive option is what we're usually talking about. So all you're doing is, what we're debating is, do they need to be held secure in that facility or can they be saved? All you would have to ask that doctor to do is another evaluation is both in can this person be safely released into the community. We'd also like your opinion on whether this person should be safe or not to possess and buy and use a firearm. Now I've already had the doctor that's doing the evaluation on whether or not they should be released, who's doing a second-sided criteria. The state attorneys can come and advocate for it, once again, with your due process and say, Judge, we're okay with them being released and going about, but we'd like to put this cooling off period, to quote Sheriff Gautieri, where we think for 60, 90, whatever that volume, they can have their due process. We already have a physician who is ready to come to testify about that. Sure, we think he can go and stay with his mother, but we need to save them. And once again, as he said, Commissioner Swearingen's already indicated, we could flag them in the existing system where that person now would not be able to go until that, it would just come up as far as to the broker. It would just flag.
You have to set up the system, which we can't. We've got the system. We just add to it, and then you have to change the law saying they can't, and they can't do it.
It absolutely requires a law change.
Okay.
Governor, I'd say one of the things, too, that's important from a law enforcement perspective is because I know many sheriffs and police chiefs I'm one of those holding my breath. Because at 2 o'clock in the morning when somebody says, hey, I've been dreaming about shooting up a school, I'm going to take his gun.
Yeah.
I got to be able to live.
So now we got to just make sure we
Yes, and so the next Monday in the morning is that. So, and I think that's what the public believes, that's what the public expects, and somebody's got to lead, and decisions have to be made. So, yes, I am giving them back when they come back, but I'm doing what I think is in the best interest of my citizens. And I think most of us are facing that every day, but we're holding that person liable every time I do that.
Mike, you want to talk about some issues you brought up in your group?
Well, first of all, everything I've heard, it's interesting, it wasn't on topic in the group, but we did talk at length about you have to remove and so I agree with everything Sheriff Gautieri was talking about. Our focus was more on how we effectively intervene from a treatment standpoint, and there was no money answer to it because we believe we need to move this fight upstream. We need to get the kids as early as we can in the process, and young adults, that we need to do much more early screening. We talked a lot about universal screening that could be done similar to how we currently do primary health screenings, hearing, vision, that type of stuff in schools. And if somebody does have an issue, that they go to a secondary level screening and then even to a third level screening where you can assess what that child or young adult's propensity to commit violence would be. And we think the only way you could do that, because I think you would have pushback from parents because nobody wants their child labeled, and yet this is a health issue. It's a public health issue. And so we would have to couple that with some extensive training that we would do in the school around mental health, first aid, training, both to staff, to school resources officers. And we already do a lot of that in most jurisdictions. We want to make it consistent throughout all jurisdictions, but also make sure that parents have that training available to them so that they understand what the screenings are for. We find, at least from a treatment perspective, that kids have much less stigma about this issue than their parents do. And so they talk much more openly about it and will be much more apt to engage in this stuff. From a treatment perspective, you can identify it, but if you don't have any place to send them, it becomes an issue. And in this state, capacity is an issue. And so we need to look at resources, and we need to do it strategically, prioritize where we make those fits. Part of the things that we're challenged by from a resource perspective is even when we put more money into the system, we have to make sure that we have a high level of coordination of care. We have so many different entities that touch these kids and families, and they don't always talk to each other. And we have got to find a way to break down some of those communication barriers so that information flows in the best interest of the kids and families that we're serving. And so that was a critical component of it. In terms of our intervention strategies, we talked about some specific interventions that we have that we think do work. But I can tell you the common characteristic with all of those is that it has to be a team-based approach, so that you have multiple folks from multiple disciplines all working together and sharing information around that kid. It has to be heavy on engagement. A lot of times kids and families don't engage right away, and you can't walk away. You have to be persistent in approaching them and engaging them in that service. And we think we need, if you're going to have a team-based approach, the way we fund these programs really needs to be around a bundled rate, and the department has had a strategy. We have pushed CAP teams, the community action teams that serve teens. And the reason we do that is it's a bundled rate, so that they can do, it's a group of professionals, it's multidisciplinary, it's fully integrated, and they are able to do whatever they need to do for that child, and it's all included in the funding, so it's not inhibitive. We do the same thing with, we have a program where it's first onset of a psychotic break. And that usually happens in a child's teens to late teens. So usually in high school, or sometimes they're out of high school and they're in college or just out of high school. And when they have that first psychotic break, the more quickly that you can engage that family and provide services, not just around the person who had the psychotic break, but to include the family in that treatment, the much more chance that family has of sustaining that person in a stabilized way with a high quality life in the community. If you don't catch them, then they're going to recycle through the system. And the sheriffs see that because they see them recycling through the jails all the time. And these are the folks that do that. So, I shared a story, and I'll share one with you. I went and met an individual who's a colonel, retired colonel in the military, big, strong. He's elderly, but he big, still has the posture. You could tell he was a lifelong military guy. And his son had his first psychotic break when he went up to University of New York. He never had a problem. But when he had that psychotic break, he went from hospitalization to hospitalization to hospitalization. He finally put this program in place. And when he was talking to me, he started crying because he said, I want to thank this program, but I want to thank the state for giving me my son back. That's how strongly he felt about it. But he had said, and what impressed me about this was, he said he's learned more about this disease and how he needs to interact as a dad and a family member to identify the trigger points for his son, to the de-escalation skills that he needs to help his son de-escalate, and those warning signs where he knows his son's about to go into crisis and to seek help that he can't provide. It's those type level of services that we need to provide. The good news is we do provide them in the state. The bad news is we need to look to enhance and expand them so that all communities have them present in their communities. Those are the big things. For us, it was prevention, it was education, it was obviously service. We talked a lot about the way you deliver services. Quite frankly, we have a shortage in this state, in particularly rural areas, but different types of services. And so we have got to be using technology more in terms of telehealth. We even talked a little bit about this new program where they do a lot of the work with kids to texting, believe it or not, which wouldn't make sense to me necessarily, but knowing my kids probably makes a lot of sense. But it's been successful. And so anything that we can do to maximize the amount of resources that we do have in the system, particularly around at the psychiatrist and psychologist level, because we don't have child psychiatrists everywhere, we don't have psychologists everywhere. And I'm not just talking about, our focus was more on kids and young adults. I can tell you this is prevalent throughout our system. But we felt the only way to get our arms around this is to move this fight upstream and get onto this issue much sooner than we have been.
Okay. Thank you, Governor. Dr. Benson, I believe?
Yeah.
Would you mind revisiting the comments you said this morning about how when a patient gets to you, you don't necessarily know how they've been treated or what drugs they've been prescribed before they got to you, and and how that affects the treatment?
Yes, I think you're referring to the comment I made about the terrible fragmentation that we have in mental health services, and it's mirrored in medical services as well.
Yeah.
Everybody's got their electronic medical record. Everybody's scared to death of HIPAA. We have all these rules about, with children, we have rules about when you can tell their parents, and we also want to respect the child's right to a confidential treatment relationship with their therapist, psychiatrist. But there is huge fragmentation, and currently I do some work in the juvenile detention facility, and the kids have been at school and they've been in our mental health facility, and I can't get the records from the mental health facility where they just were last week before they got discharged, went to school, got in a fight, they get back to the detention facility, and there's no continuous roll through of information so that we have a seamless system of care. And I'm not sure how to fix that, and I think it's a serious problem. They said we're going to get electronic medical records and fix it completely. Electronic medical records have made it worse.
Right. It's made it hard. Mary, one thing I think we talked about is that the way I look at it is, let's say we're going to say X dollars, we're going to put X dollars in, and we're going to say our school system is going to do assessments. And so do you feel comfortable that if we could set a standard and that actually would work, that would make a difference of what the expectation was?
I do. I think there's two important. First of all, there are standardized measures that we can do for screening. So we can look at the literature around what are those measures. And then I think also the important piece is if we do start doing that and we're doing the assessments, there has to be some place to refer the child, youth, and family, right? So it can't be just to that piece, but it's like from a public health perspective, you have to do surveillance. So it's our way of making sure that that's happening. So you do the assessment, the screening, and then, like Mike said, if needed, then you do a second and maybe even a third level. But then there has to be immediate access to services. I mean, one of the things we talked about this afternoon is the right services at the right time for the right youth and family, right? And so making that happen is critical, but I'm also convinced we can do that if we have the resources.
So it's a reason why, because we do fund services, right? Mm-hmm. Now maybe we don't fund enough services, that's part of it, right? But so there's not coordination. I mean, is it because is it fiefdoms on where the dollars are going? Is that the reason why?
No, I don't think the coordination issue is around an unwillingness to cooperate. I think HIPAA and some of the federal statutes around confidentiality prohibits us from doing it. But I think it's particularly difficult. It's difficult for us to develop a highly coordinated system of care just within the mental health system. Then when you have to coordinate that through the school systems, and the school system has their own mental health counselors, some more than other school systems, and the linkage between those mental health counselors in the schools and the work they're doing, and then the linkage to the community mental health services is not always what it needs to be, because they need to be working hand in glove. And so what we were talking about when we talk about breaking down those barriers is we have to have a coordinated system of care where those professionals that are working with that child are fully talking back and forth so that the treatment that we are delivering is aligned to what the school's trying to accomplish, and quite frankly, it's aligned to what the parents know. You know, it blows my mind that, and the doctor brought this example this morning, where sometimes the doctor asked a family, well, what is the treatment plan your child's working on? Well, I don't know, because they won't tell me. You know, it's confidential. Well, my Lord, that, you know, how can you make progress if all of the folks important to that family member are not involved? So we have lots of systemic work to do around coordination here. And Governor, you issued an executive order a couple of years ago to look at that very issue. You know, and I do think that we've made progress. And I think in the short term, what we've done is, and you can see it in the implementation strategies that we've used the last couple of years in the implementation of the coordinated specialty teams, the CAP teams, the FIT teams, and even with some of the criminal justice reinvestment grants. It is all targeted at a certain population, but built within those programs, it really forces a lot of the professionals around the table to work as a team, so it's team-based. and the way it's funding, it promotes that. But even within that team, those teams have to be able to coordinate with folks like the school system and others that are dealing with that kid at the community level.
So right now, the CAT teams, because we've increased the funding for CAT teams, so do you need one more? And then do you need to change their job, what they're trying to accomplish?
Yeah, well, and I don't want to suggest that CAT teams are the. I don't think there's one answer to this issue from a treatment perspective. I think the answers are many. I think the CAT teams are one. We have CAT teams, and you and the legislature have been very good at rolling those out. We don't have them in every community. The specialty care teams, where we look at first onset of psychosis, they work very well in the communities. We have them in, but we don't have them in every community. We have tried to, every year, kind of expand our touch there. The criminal justice grants, I can tell you what we talked about. We need a high level of collaboration and integration with the school system. We've had a lot of success issuing criminal justice reinvestment grants where we put it out to a community. It's a 50-50 match with a local match of state dollars. And what I love about those grants is it's the local folks who come up with the program. So it's based on your community, what you need, how you want to run it. Everything is measured. We have standard measures that we measure. And then everybody has a stake in the game, but it forces a level of integration that didn't exist in the past. With respect to the schools, I don't know why we can't use a similar model in working with the schools to do these reinvestment grants with local communities. And if a local community wants to say, hey, I have an idea on how I can strengthen the linkage between my mental health counselors on the school and the community mental health treatment centers in the community, because when that kid goes home, that treatment needs to continue and the family needs to be brought into that treatment. Or I have a great idea for developing a crisis response team for my school district that can lower the numbers of kids that have to be Baker acted, but get out there, respond to crisis, and get a kid into services. I think it would be a great way for local communities to begin doing what we do in other areas the same way. So that's kind of.
So these different teams, do you have good working relationships with the law enforcement?
It's not just law enforcement that we do it with. It's different in every community, but in those communities that have the criminal justice grants, I think they work well.
One of the things that we see, Governor, is, and the Secretary mentioned it, is the importance of coordinated care. In a lack of, and I can tell you in our area and others, I'm not sure about the entire state, but I can tell you for sure in our area, the greatest void we have is the lack of master case management, the lack of discharge planning and case management. When people get out of the receiving facility, the Baker Act, the discharge planning is not there. They get a card told to show up. If these people could solve their problems on their own, they would. They can't. They need help. And the Pinellas County Commission funded a pilot, and it's a high utilizer program, as it's called, and they committed $1 million to it. And it is intensive case management, and it's working. A lot of these people, and as I said to Commissioner Putnam earlier today, we were talking, somebody needs to own these people. Somebody needs to direct them. And I am not an expert in this area. I dabble in it because out of necessity we have established our own mental health unit. I work closely with a lot of mental health providers, etc. And I really believe that a void is master case management and would support a concept, maybe a trial in some area, of an actual case management entity where somebody is seeing all of the pieces, putting them together in one place, and directing that care and overseeing that care. The treatment providers are doing a great job, but they're in silos. And you have people that are touched by this one, touched by this one, touched by this one, and it's not being navigated or master case managed.
So, go ahead.
When I hear about the sharing of information from one group to the other, because a lot of times we get locked in where we can't share with everything, under Sheriff Dulcie, probably about 20 years ago, we started a program where we signed an MOU with DCF, DJJ, YFA, State's Attorney's Office, and a few other agencies. And then what we will do is we identify students, usually beginning in the elementary world. We serve probably about 200 students. Because what was happening in DCF, they may be in the DCF system, we wouldn't know that, or if they were DJJ, we wouldn't have known that. So once a month, they all come together and meet.
100% because of privacy, not because people don't want to coordinate.
Exactly. So now we can call, my staff can call DCF and say, I have a student of interest, and then they open up because they meet once a month, and they share all that information about that one student. Then we take the social workers, and sometimes they go out and work with the family. Where we run into the roadblock is when we tell the family, well, Johnny needs help, and many, many times they say, you all deal with it, or we're not going to carry on for that because of the intensive counseling. Now, in our group today, somebody said, well, when parents refuse that, maybe we take some of their rights away.
Governor, the honest answer to the secretary you asked, in my role, I don't want to speak for Kevin or Mike or any of the others here, my intersection with mental health providers, very minimal. I intersect with just about every other portion of my community, my schools, but my intersection with mental health is virtually non-existent. So I give you one perspective. I don't know how.
Similar perspective from Dade County. There's just no real integrated communications. They're just being released and falling in the crack.
It's because nobody owns it. And this is where I've injected myself into it by establishing a mental health unit and a whole bunch of other things that we're doing. But there is no one place or one entity that is saying, okay, I'm going to take all the available information, I'm going to look at the individual, and I'm going to direct the care of this person, and you're going to go here to substance abuse treatment. Most of this is all co-occurring disorders, but not everybody treats everything. So in dealing with the families and trying to engage, especially dealing with younger people, one of the greatest challenges to engaging the young people in services is getting their parents to engage. Is that a lot of the times the barrier is the parents won't engage. So you need somebody to be able to go out, and again, that's what's lacking is that master piece.
So take your county, Sheriff Oteri, take your county for a second. So when you say you're going to do it, how many people are you dealing with in your county? How many people live in Pinellas?
1 million.
1 million. So how many people are you dealing with? About?
A lot, tons. A lot.
I think I've told you I have a relative that's gone through. All these issues.
Yes.
There's no coordination. I can just tell you.
No, there isn't. And that's where. And so the high utilizer is that what we took was the highest people that were crossing between the criminal justice system and the mental health system. Right. We book about 50,000 people a year in the jail. That's not 50,000 different people. That's a whole bunch of the same people over and over again. We do 11,000 Baker Acts in Pinellas County. That's not 11,000 unique individuals. So you get a lot of recidivism. And one of the reasons is because, again, when an incident happens, the next time that they get touched is when another incident happens.
Right.
And so we're not being
the same problem with DJJ. Remember, we had the repeat offenders with DJJ.
Right.
The exact same thing.
We need to be more proactive. And this is what we've done with this mental health unit because we brought case management to the street. So I have deputy sheriffs who are crisis intervention team trained that are teamed with, and we're paying for it, licensed clinical social workers. And every deputy who takes a report is required to check on that box whether there's an indication of mental health or not. And then the supervisors are looking at it, and when we see 2 or 3 indicators, we're not waiting for a problem. We go out, we knock on the door and say, what do you need? How can we help? How can we engage? And so we're doing that and then engaging really in case management and trying to get them into services. But law enforcement's getting out of its wheelhouse when we're starting to do those kinds of things. But we're doing it because there's a void, and we've got to fill it.
It probably reduces your overall crime rate, too.
Oh, absolutely, because we're having so much contact with these people because, yes, we're holding their hands, and yes, they have an intensive amount of contacts, but that's what's necessary. And, again, then I go back to, these people can't do it on their own, and we take somebody and we say, okay, here's your treatment. Now, go to this next appointment or show up here or make this phone call. They just simply don't do it. Yeah. And it falls by the wayside. So unless somebody, when they don't show up for the appointment, and so we encourage the providers in our area, if you have that, call us. We'll send the mental health team out. We'll go out and knock on the door and say, why didn't you show up for your appointment today? Those are the kinds of things, but it needs to be, again, tailored.
It's usually a family member, and there's a lot of family members that are tired.
Right, exactly.
They're just tired. I'm tired of dealing with,
And that's why we don't get tired. That's what we do. But I would, I think that the discussion, and I just, asked Mary, she's an expert in this area, as I was sitting here, do you agree with what I'm saying? And she said yes. And so, this is, but we talk about this, and in fact, we're starting a pilot on our own to develop a case management system in Pinellas because there's just such a void. On top of the high utilizer, we're actively now. We got a $500,000 from the county commission. There's an organization in Healthy St. Pete that's going to give us another $500,000, and we're not waiting. We're moving it. We're going to get off the dime on this because we believe that it is an answer and an important answer to helping these people and ending the cycle. And that's where it's falling apart. And not just with kids, with adults, but these kids, like this guy down in Fort Lauderdale, he's a kid, but he's 19, so he's not in the juvenile side, he's in the adult side. And it's the same thing. You get all these indicators, nobody's connecting the dots on it.
Governor, we have an issue where when we Baker Act someone, the deputy is responsible for going back 2 or 3 days later, a week later, on his own to check back on this individual, because obviously they were in crisis at the time. Because what we find is a lot of times with the Baker Act system, they're in one door, they're out the other door. We go, well, what did they do? And they say, well, they gave me this piece of paper and told me to show up for services. Well, have you gone? Well, I didn't have a ride. Well, why didn't you go? Well, I felt better. Well, did they give you any medicine? Well, they gave me a prescription, but I didn't have any money to buy it. And
or they self-medicate.
Or they self-medicate. So, and like Sheriff Terry said, we're outside of our wheelhouse, but we're going back and checking on these people. You know why? Because we care for them. We have a system in place at the office where if you have 5 or more calls for service to us in a 30-day period, a month period, we go back in a non-emergent environment and go, what's the problem?
Right.
Because we know that most of us haven't called law enforcement 5 times in our life.
Right.
And many times what we see is the same thing. They need services. The kid's running away. Why is the kid running away? Because of the issues at home. What's the issues at home that's causing the kid to cut and run away? Or do all these nefarious things that we see that tell us that there's a potential threat in the future? Some of this is long-term, but the reality is we have stepped into a role that we're really not.
You don't have a choice. I mean, you're going to deal with them.
Right. We're short-term problem solvers is all we are.
Pam, you want to talk about your group?
Surely. Well, obviously, we talked about the fact that this is a multifaceted issue. It's not one fix. And we sort of bucketed in some areas where we talked about the mental health because it does cross over into the school system. And also practices or policies that could help with safety. And then the facilities issues. So we fully explored all of those. The issues that you've been talking about with regard to the SROs and the mental health, those all came up in the group. And being able to identify, okay, if I can identify this individual for assistance, will there be the capacity in the community to address those mental health issues that they are seeing? There was also discussion about whether or not there's enough of those kinds of resources within the school system, because our guidance counselors are really doing other kinds of services. In the elementary level, they may speak to mental health issues with students a half a day a week. And of course, we know in the high schools, they are really academic counselors. They are not mental health counselors. As much as they would like to be, as much as they thought they went to school to do that, that's not what they're doing. And so it's sort of described as a tiered approach. If we do more to address that tier 1, which is what everyone needs, which is the social emotional, and are not waiting until we get to tier 3 or tier 4, we can, in the mental health area, actually do more good and have fewer that are going to need to reach the level tier 3 or tier 4. We did talk about SROs and exactly the issues that you talked about. The ratios, the large campus, how do we have SROs everywhere that they are needed? And we actually talked about the gap, those times when there's no one, and especially at the elementary level. It's where we think about those individuals less. It's about building a relationship. So if you go one day a week, you're trying to build relationships. That doesn't necessarily happen. There was discussion about the need for coordination of information between agencies, among agencies, so that we are having more of a coordinated effort to address those issues with students. And then thinking about the building itself. And should there be, and how do we establish what the base of the requirements are for safety in schools? It's all over the map. Those individuals that were there in the room, we had about 27 that represented schools in some way, and it's all over the map, from being exactly what you would hope that a school would be and have the building and the practices exactly what is needed, to hoping that things are going to remain safe. And so it's just all over the map on where are we. But establishing some of those things where we do have active shooter drills, that's already been talked about. But I will tell you, one of the reasons we don't have common active shooter drills everywhere is because it is not required in law. The fire drills are required, bomb threats, all of those things, but the one area that is not is active shooter drills. And I think that really is because those requirements that haven't been looked at since they were put into place many, many years ago, they served their purpose. You think about fire drills, there was a time when that was important. It's still important. But we have new things that are important that have to be included and required of districts. What are the basic things that we need to do, and do we want to set some standards statewide and have those that are approved by law enforcement at the state level? How do we want to set that up so that we are ensuring that we're recognizing that districts are different, but we also are establishing some baseline that everyone has to have in place so that there isn't such a diverse area. We had that I don't think existed in any one of the other groups. We had a student from Broward County. Interestingly, he attends Coral Springs High School. He lives in Parkland. And so he had convened a group over the weekend and had come up with many ideas that those students felt would be important for school safety. They had single point of entry, metal detectors, more SROs. Those were all the kinds of things that came up through
They're good ideas.
students. They did.
They're logical ideas.
He advocated for drills, more drills.
He said that 3 weeks ago, he also is the student advisor to the school board, so he attends every school board meeting, and he advocated for required active shooter drills as a requirement in the schools. And he felt that that was important because even if you train your administrators and your teachers, if something happens to that administrator or teacher in that classroom, if I don't know what to do as a student, I am literally a sitting duck. Where if I've practiced and I know what to do, regardless of everyone else around me, I have the ability to save myself and maybe others as well. There was also talk about potentially trauma kits, so that when there is a shooting, students might know what they could do. Some tourniquet availability, those kinds of things.
Chief down in Coral Springs was talking about that when I went to
fewer lives lost.
Yeah, with the like you said, the clotting stuff and stop the bleeding faster and stuff.
They actually set the standard, and now we all in North Broward have gone to the full SWAT gear, chest occlusion, everything. So,
what's the pushback on active shooter drills?
Probably time, and we also talk about the fact that we get complacent. We do think about schools as being the safest place that you could possibly be, and we tend to get complacent. And so I think probably one of the biggest things is that we have so many things that are packed into school days, and yet it's not a requirement. So, yeah, I kind of know I need to do that, but it gets pushed to the side, where you don't miss a month without a fire drill.
Governor, I know the time's going to slip away before it does. I would be remiss if I did not say how impressed I was here today. Coming home is always great. Coming home on this duty was a bit tough. Having watched this from a distance and seeing how it's played out, the enormity of this tragedy, something better doesn't come as a result of this, all we're going to be left with is an enormous tragedy. And to come here today and know that I work with a secretary who has already asked Congress to step up and do their part. And after I go back tomorrow and report back, the notion that that's what we're asking. We're not asking anything of any one particular group, entity, or individual. And today was a real illustration of that. I commend you for the process of getting so many people from all over the state and so many different and varied walks of life together to not just sit around and talk about the tragedy, but to actually get down into the weeds and begin to talk about possible solutions to these kinds of tragedies and others. It was very, very impressive. And the fact that in the group with the commissioner today, we were able to actually mine down into some very specific issues. Some cost money, some may not. Some may cost lots of money. Some may require state law changes, some may require congressional law changes, some may require new school board policies. But at the end of the day, what everyone made it clear is that there is no one solution to these kinds of things. And by virtue of that fact, everybody working together was an enormously impressive thing to witness today. I look forward to going back tomorrow and reporting out what we have seen here today. Because again, I'm not here only representing Florida in this particular case, but the entire country. And students all over the country who are searching for the same kinds of solutions to the same kinds of potential problems. It makes me very proud to know that I come from a state that has worked so very hard on this. And lastly, I know the people in Broward County must be incredibly proud of the way this state has pulled together on their behalf, not only to pay tribute to this horrible tragedy, but also to begin a dialogue. And I leave you with this, that when we talk today, I say, sometimes after these tragedies, people shout, do something even if it's wrong. Do something, for God's sake. And oftentimes nothing happens as a result. I really leave with tremendous optimism. I really feel the optimism that people here feel, that this is not just about screaming into the wind. This is about looking for real solutions, many of them, to the problems that we face. So thank you, Governor, for giving us the chance to be here. And I know I speak on behalf of the entire country in this particular case in education. When I say what we're going to learn here, I think it's going to pay great dividends to everyone down there.
I think one of the other things, Governor, if I could just add this, that having a plan is extremely important, and that came up today. I think one of the other things is that there are portions of a plan that everyone needs to know. And there are portions of a plan, and I think law enforcement would agree with me, that have to be kept as confidential, or you've lost the ability for that plan to be effective.
Yeah. So do you think that if we put the money if we get through the budget and we get more money into the budget, do you think it'll get spent in a manner that really is going to harden the schools? Do you feel good about it? I mean, this is what you do, right?
Yes, sir. As I said today, I believe our schools are very safe. Parents don't want to hear that from us today. We handle things day in, day out, but what we're talking about this week is targeted school violence, the active shooter scenario that played out there in Broward. And in terms of how do we harden all Florida schools. So to your question, when yes, there are needs across the board. There are districts that have everything on the wish list, like Commissioner Stewart said. There are schools with single point of entry, security cameras, their own security staff. They're doing drills. They have tools to communicate with parents, tools to communicate with students. And then you go to other places in the state, and it's not. And as it was discussed today, anyone could be a target of this. As I drove into work this morning, we had 4 schools where there was an Instagram post that said, y'all stay home today. They're going to shoot up 1, 2, 3, 4 schools. This was a post that was brought back to 2016 that played with the topic. And so those schools all day fielded calls from parents. What I know that will make a huge impact is an assistance in terms of the intelligence community helping us with social media to identify threatened students or to identify students that want to create chaos in schools so that we can get to them, teach them a strong lesson. And hopefully we, by doing that, and they know that we show up, they know that we follow up, we know we try IP addresses, that hopefully we can reduce that, because it's not, these incidents are horrific, but the fear that permeates between parents all over right now is at a tipping point. And I think we do need, as I said, my closing remarks today, it's very clear to me that schools are the #1 critical infrastructure that we have to protect. And in order to do that, for a long time, I said when I went to high school, I didn't have an SRO, we didn't have fencing, we didn't have cameras. I don't remember any drills, none, not even fire drills.
We never met a policeman growing up. You didn't want to. If you did, you got in trouble. So every time you met somebody.
So it's a new day. There's much higher expectations, and we need to provide every resource we can to get those people safe.
Is there anything else you wanted to add?
There were some other details, but I think that's the essence.
Okay. Is there anything else anybody wants to bring up?
Governor?
Yes.
To John's point, with the recent tragedy in Parkland, a lot of agencies have been faced with the threats to the schools over this last week. And you can read in the paper, we see dozens of reports where law enforcement has called to that. And I think there's a great disconnect. Also, same with the Baker Act, with our communities that think the threat against the school is against the law. And as the current law is written, it's not really against the law. And so one of the things that's immediate for us is we have the opportunity, we have bills out there in front of the legislature that will make those threats against, that are not specific to a person, criminal, and gives us additional tools to deal with that. And so they're currently sitting before our legislature.
Okay.
Governor, as we close, we saw your leadership during the hurricane, and we're seeing your leadership now. Everyone in this room is here today because we care for the people of the state of Florida, and we love our children. And the lowest common denominator is if we can't protect our children, nothing else good can happen.
If you go to the funerals, that's what the dads say. They said, my only job was to protect my kid. And that's the way you look at it. Protect your kids, and if you have grandkids, you protect your grandkids. And our jobs were, if you're running a school, your job is to protect, everybody you've got a fiduciary obligation, and you care about every child. So, and I'm sure in your communities you do the same thing. So. Oh, yes.
Hi, thank you, Governor. The word that I heard from every group today, and I was in the mental health group, was team. And I want to say that, if you look at the programs, and I'm at Meridian Behavioral Health Care in Gainesville, and I have 11 rural counties in addition. And we have CAT and FIT and a reinvestment grant. So I kind of see what happens when you have these team-based approaches. I'm not worried about who is getting paid to do what. I'm worried about who I'm interacting with to make sure that that child or that person coming out of jail or that person leaving the CSU is going to make their medication appointment, is going to have somebody pick them up if that's what it takes, who's going to go knocking on the door and say, is this what you need? Are you ready now? Let us help in whatever way we can. And so I think a lot of the frustrations that we have around Baker Acts and follow-up, it's not necessarily more money, although Lord knows this mental health system could use more money. It's also how we spend the money. When we have team funding rather than fee for service, I'm going to pay you to do this action, and I'm not going to pay you just to be available when the minute a crisis hits. I think we could make a revolution in how we deliver care if we move to a different form of how we pay for what we do in the whole mental health field. So,
that's what we tried to do, and that's what we worked on doing when we did the executive order. It was easier because these were state agencies, right? And one thing I've tried to do when I sat down when I first got elected is to get all the agency heads to become people that want to work with each other.
Letcher County was one of the counties that looked at that. And like I said, every time I see team, and it can, bundled rates, case rates, capitation can work with Medicaid, can work with DCF funding, can work with any of our partners, and we are much better when that's how we're funded.
Right. And it's much better if somebody is actually accountable.
Yeah.
And
the accountability then is to what that patient needs, not to what I'm going to get paid for.
Right. That's right. With a result.
And I'll just add to that, because I'm echoing again, is that's why if you had a case management entity that was responsible for that, that's not driven by pay points for services, et cetera, you'd probably have a much better system with somebody who's responsible, and that comes back to the case
And
management.
that's, when we have case managers under a bundled payment, that's exactly
Right,
how it
because
works.
and that's the issue, and if you had that, it would eliminate some of this.
Okay, so we can let everybody finish and say what they want. Here's my goal. My goal is Friday. I'm going to come up with a proposal, and it's going to be as well thought out as I can make it. All right, and I'm going to take all the input that y'all have given me, and I'm going to talk to as many people as I can. And I know all of you are going to continue to want to be involved, but what we got to do is it's going to be a proposal that's going to go through a legislative process, and it's going to need continued input. Because everybody's going to have they're going to have the nuances that are going to make a difference whether it's going to work or not. And so my goal is to come up with something that is going to move the needle and make parents feel more comfortable that their kid's going to go to a safe school. That's the goal. I mean, these kids have got to go to safe schools. So as we go through this process, I hope everybody stays involved, and you know whatever we put out there, you can be involved, critique it, change it, and whatever. So, but in 2 weeks, we got 2 weeks left of session. Those 2 weeks after Friday, we're going to get something done. I mean, it's not fair to our kids. Anybody else?
We have them in the same room, just kind of a business plan. And Pam, while we have you in the room and some of our biggest sheriffs, we have 67 counties, we have 67 superintendents. We're the third largest state. We're hearing disconnect, lack of communication. We need to be a team. What if we worked with our police chiefs, but we have only 20 judicial circuits? Governor, what if for you, everyone broke it down into 20 circuits? That's much more manageable than 67. And we picked the biggest geographic superintendent and the largest sheriff of that judicial circuit. So we'd have a team of 20. And the chiefs and the other sheriffs would work with them. Then you're only getting back a report from a team of 20 instead of 67. Because, again, some of these schools aren't having resource officers, they're rotating, and you're going on fast forward now. And so if we can get you, in a week, 20 sheriffs and superintendents, and the chiefs, if they'll work with the sheriffs, and the other sheriffs will work with the just geographically, the largest sheriff, and come back and say, these are our schools, then you only have 20 groups reporting back to your staff as opposed to 67.
May I suggest the three districts, or the three districts that have their own police departments, the school, police chief for that area? Like the 11th circuit is
Absolutely.
one county, so that's simple. That's
right.
One circuit, one county,
right.
one district.
Right, of course.
Well, I want to get everybody, whatever everybody thinks about that, we can talk about it, and just give me a call. I think everybody in this room knows how to get a hold of me. I'm pretty easy to get a hold of. I think everybody in the state has my cell phone by now.
And I have a funny story about that. I was at the Hard Rock Cafe one day on a Saturday. Governor Scott
Just having lunch.
I said, the governor found me.
Which Hard Rock? All right, anybody else? Okay, thanks everybody.
Good to see you.
That's right.